Hi, my name is Irene Hogan and I'm an award-winning pharmacist and certified menopause practitioner. Regarding bioidentical hormones, I think since the Women's Health Initiative in 2002, we have really done 360. Before that, we were prescribing hormones to all women to prevent cardiovascular disease, to prevent osteoporosis, and prevent dementia. The Women's Health Initiatives gave many women and physicians and healthcare practitioners concerns about who to prescribe them to and when. I think what Suzanne Summers is doing is she has done a lot of research into bioidentical hormones and interviewed some of the key anti-aging physicians in the market. Don't shoot the messenger. For some women, bioidentical hormones is absolutely going to be a quality of life issue. And I really think since the W Health Initiative, we have decided that in women, definitely near menopause, that are healthier, that really the benefits outweigh the risks. And most of the societies, such as the Societies of Obstetricians and Gynecologists in Canada, the International Menopause Society, have said the same thing too. That if we're going to use hormones beneficially in women, that it should be the lowest dose for the shortest period of time. And again, I think what we weren't doing before is we weren't monitoring, we weren't tailoring the dose to these patients. The other thing is that I explain to my patients is bioidentical hormones do not have to be compounded. There are some commercial products that are bioidenticals. These would be compounds such as estrogel, the estrogen patch, and then prometrium, the oral capsule. However, we do believe that there's a difference between topical estrogens and oral estrogens, and estrogens should be used topically. However, for some women, the estrogel is too strong a dose. Maybe we need to dilute it. Maybe we need to use a topical progesterone, which is not available commercially. And also, we need to be looking at all hormones, not just estrogen and progesterone. We need to look at testosterone, we need to look at DHEA, and we need to look at cortisol levels in women, because stress, if a woman is out of balance before she goes into menopause, then she's more likely to suffer from severe symptoms. So I think what we need to come up with is not the cookie cutter approach that we did before with Prema and Pravira, where everybody got the same. We need to individualize it for the patient, and compounding allows us to do that. Also, a number of the studies in Europe have shown that when we use bioidenticals, i.e. natural estradiol or estriol along with progesterone, there is not actually an increased risk in breast cancer. And estriol is used very often in women in Europe, and again, we don't use that here in Canada and North America. And compounding allows estriol to be made up for the individual patient for that woman too as well. So I think you need to have a consultation with a health practitioner that is certified as a menopause practitioner, or an obstetrician gynecologist that is open to using bioidentical hormone and gives you the time to ask questions. And what I recommend to women is that they become informed, they become educated, and consult a menopause practitioner. Thank you.